In this video, explain will be why smoking regarding Georgia State University matters, and having a smoke-free environment can improve the university and its body, from the effects of smoking to how they relate to GSU. To start, let's look at what's in a cigarette. There are approximately 600 ingredients in cigarettes, two ingredients being tobacco and fillers. Cigarette tobacco is blended from the leaf varieties Bright and Burley tobacco. Bright, also known as Virginia, contains 2.5 to 3% nicotine, while Burley contains 3.5 to 4%. Meanwhile, fillers are made from the stems and other bits of tobacco, and water, various flavorings, and additives have involvement as well. In tobacco smoke, there are more than 7,000 chemicals, including butane, formaldehyde, and cadmium. Smoking has multiple effects, including but not limited to lung cancer, eye disease, heart and vascular disease, chronic obstructive pulmonary disease, COPD, increased risk of breast cancer, eye disease, and type 2 diabetes. Going back to the 7,000 plus chemicals, at least 69 of them are known to cause cancer. Additionally, tar is created, which can stain teeth, coat gums, the tongue, throat, and vocal cords, and along with hydrogen cyanide, can paralyze the cilia. With these in mind, one reason for having a smoke free environment at GSU has been found. A second reason is concerned with secondhand smoke, or involuntary and passive smoking. In a Cleveland Clinic page, it is stated that adults exposed to secondhand smoke may experience cardiovascular disease like high blood pressure, arteriosclerosis, heart attack, or stroke. Lung problems like chronic obstructive pulmonary disease, COPD, and asthma, increased risk of lung cancer and breast cancer, reproductive health problems like low birth weight when exposure occurs during pregnancy. Additionally, it is also stated in that same page that studies show that you're up to 30% more likely to develop heart disease if you're regularly exposed to secondhand smoke. For secondhand smoke, children alongside infants are more likely to experience frequent and more severe asthma attacks, respiratory infections such as bronchitis, sudden infant death syndrome, SIDS, and increased risk of brain tumors, according to that same page. Additionally, stated in that same page is that studies have shown that damage from secondhand smoke occurs in as little as 5 minutes, and inflammatory and respiratory responses occur almost immediately after 5 minutes. Arteries become less flexible, just like they do in a person who's smoking a cigarette. After 20 to 30 minutes, blood starts clotting, and fat deposits in blood vessels increase your risk of heart attack and stroke. After 2 hours, an irregular heartbeat arrhythmia can develop and trigger a heart attack or other serious cardiac problems. Attention will be given to excerpts from 2 pages. From the first one, titled Occasional Smoking in College: Who, What, When, and Why. The purpose of the present study was to further examine, using a qualitative approach, self identify and motivational forces for occasional smoking by college students. Our findings are similar to the few existing qualitative studies of young occasional smokers regarding their self identity as smokers and opinions on occasional smoking. Berg et al. 2010, Thompson et al. 2007. Novel findings of the current study include the degree to which occasional smokers engage in impression management and the underlying internal conflict regarding smoking that they endorse. Many students were careful about when, where, and with whom they smoked. Smoking was favorably viewed in some contexts, but clearly stigmatized in others. This suggests a strong degree of impression management that guides smoking behavior among occasional smokers. The literature in this area is scant, but one previous study reported higher levels of self monitoring and perceived success in impression management among high school students that occasionally smoke compared to their regularly smoking or non smoking peers. O'Callahan and Doyle, 2001. Clearly, this is an area for future research, particularly given the importance of social identity as a determinant of smoking behavior within young smokers. Cobus, 2003. The active conscious decision to smoke versus not suggests a possible internal tension regarding self portrayal in various social situations. There also seems to be a deliberate effort to avoid becoming a smoker. This finding is worthy of further study. If supported, such tension could serve a clinical purpose in at least two ways. First, some research suggests that smokers experience a period of dissonance over their smoking and that such dissonance remains dormant until a cue to action. West and Sohal, 2006. Presenting cues to action in a meaningful way to occasional smokers may serve a catalyzing purpose to advance quit behavior. Though it remains to be studied what cues would motivate occasional smokers in particular. Second, the public health community could try to capitalize on and heighten this tension through specific messaging, such as worried that you are beginning to smoke too much, or are you starting to smoke in places you never wanted to? There is a danger in such messaging, however, as it could falsely convey a safe level of smoking. From the second page, titled Smoke Free and Tobacco Free Policies in Colleges and Universities, United States and Territories 2017, because nearly all adult cigarette smokers begin smoking by young adulthood, 2. Colleges and universities can serve an important role in preventing tobacco product use initiation among non users, while also protecting students, faculty, staff members, and guests from secondhand smoke exposure. In 2015, approximately 40% of U.S. adults aged 18 to 24 years, 12.6 million, were enrolled in 4562 degree granting post secondary institutions, 6, and a substantial proportion of young adults currently use at least one tobacco product. In 2015, 1 in 5 adults aged 18 to 24 years, 21.4%, reported using a tobacco product some days or every day. 7. Moreover, 23.8% of adults who attained some college education but received no diploma reported current use of at least one tobacco product. 7. Given the trajectories of tobacco product use and initiation among young adults, interventions targeted toward this population, including tobacco free and smoke free policies in colleges and universities, might help accelerate efforts to reduce tobacco product use among young persons. 1, 2. These excerpts can be taken how anyone will. What does any of this have to do with GSU? According to the 7th Community Living Guide subsection, smoking of any kind is prohibited in all residence halls and within 25 feet of all entrances and exits. But there are designated smoking halls, including University Commons and Piedmont North. Prohibition of smoking could be extended to the rest of the university, and so could having designated smoking areas. That way, those who smoke can still do so without worrying about breaking any university rules. Wrapping up, on October 1st, 2014, a policy at Georgia Perimeter College went into effect. Stated in a 2014 GPC newsroom article, according to the new policy, use of all forms of tobacco products on property owned, leased, rented, in the possession of, or in any way used by Georgia Perimeter College is expressly prohibited. And tobacco users caught on campus by public safety officials will only get a warning during the first 6 months, but some next April, individuals not abiding by the policy will receive a warning for their first offense, a $10 fine for their second offense, a $20 fine for their third offense, and a fine plus disciplinary action from their campus student dean or department supervisor after the fourth offense. In this video, brought up were the effects of smoking and secondhand smoking, excerpts from where occasional smoking and smoke and tobacco-free policies were subjects, a subsection in the Community Living Guide, and a policy at Georgia Perimeter College. With these, having a smoke-free environment can improve the university and its body.